Every 24th March is commemorated as World Tuberculosis Day to raise public awareness about the devastating health, social and economic consequences of TB. The theme for this year's commemoration is "The Clock is Ticking," which conveys the sense that the world is running out of time to act on the commitments to end TB. Amin Dow files in this report.
Tuberculosis remains one of the deadliest infectious diseases in the world, despite the preventive and curable measures taken over the years. The world marks TB Day for the international community to call for more actions to eliminate the disease by 2030 amidst the ongoing COVID-19 pandemic. The World Health Organization says nearly 4,000 people die every day from TB and close to 30,000 people fall ill with TB. The director of programs at UNITAID, Robert Matiro, says about a quarter of the world's population are infected with the latent form of tuberculosis.
Despite being preventable and curable, tuberculosis is one of the deadliest infections in the world, killing 1.5 million people each year. 10 million people fall ill with tuberculosis each year as well, and many of them are children, almost 900,000, and most live in low and low-middle-income countries and some of the poorest countries in the world. It's also the leading killer of people with HIV. About a quarter of the world's population, roughly 1.7 billion people, are infected with TB, the latent form. However, this is not treated with preventive measures and therapies. It can become active and people will become sick and die as well.
Mr. Matiro also says UNITAID has been working with WHO and other organizations to bring new treatments for TB prevention.
We're going to have any chance of ending TB in the next 10 to 12 years, we have to prevent it in the first place. UNITAID has been at the forefront working with many partners, with governments, manufacturers, civil society actors, and the World Health Organization to bring a new treatment for preventing TB, which is called 3HP. We are combining two treatments into one, which reduces how many pills somebody has to take a day from 9 to 3. It's easier to do this, it reduces the logistics and the packaging, and we've also lowered the cost by over 70% for this treatment, which is really important.
In 2019, 10 million people suffered from TB and close to 1.5 million people, over 95% of whom were living in lower and middle income countries, died due to the disease. TB remains the leading cause of death among people with HIV, as global progress in the disease prevention is lagging behind. TB Day began on 24 March 1882, when Dr. Robert Koch announced that he had discovered the bacterium that causes TB, which opened the way towards diagnosing and curing the disease. Reporting for iAfrica News, I am Amin Dow.